Welcome to Doctors on Call. I'm Jenna Miller. A concussion is a type of traumatic brain injury that happens when your brain is jarred or shaken hard enough to bounce against your skull. This can happen when two athletes collide, or someone falls and hits their head or is hit on the head. If recognized and treated properly, most people will recover fully from a single concussion. However, if someone sustains multiple concussions, they're more likely to experience prolonged post-concussion symptoms or cognitive impairment. Concussions, that's our topic today on Doctors on Call with our guest, athletic trainer and physical therapist assistant, Andy Hurla.
Presentation of Doctors on Call is made possible in part by an underwriting grant from Grove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A Value Kansans Trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
10 seconds. Andy Hurla is a native of Tonganoxie, Kansas. He attended Fort Hays State University and received his bachelor's degree in general science and health and a BS in health and human performance with an emphasis in athletic training. Andy continued his education with a Master of Science in health and human performance with concentration in sports administration. While affiliated with Christus St. Francis Cabrini Hospital in Alexandria, Louisiana, he worked as an athletic trainer with high schools in Louisiana, was an athletic trainer with the Louisiana Rangers indoor pro football team and the Alexandria Aces, an independent league pro baseball team. Andy was also the head athletic trainer for Louisiana College in his last year at Cabrini Hospital. He returned to Kansas in 2009 and became the first athletic trainer employed in the rehabilitation program at Russell Regional Hospital. Andy provides athletic training services to USD 407 and Russell High School. In 2017, Andy completed an Associate of Science in Physical Therapist Assistant Technology and became a licensed PTA. Our phone lines are open at 1-800-337-4788 toll-free if you have any questions regarding concussions on today's show. Doctors on Call brings you information which may be useful to you when you see your own physician or therapist. We'll go ahead and get started with some questions of our own. Thank you so much for joining us tonight.
Yeah.
First of all, how does the athletic trainer role differ from a physical therapist?
As an athletic trainer, primarily I am supervised by a practicing physician. In the case here at Russell Regional Hospital, my supervising physician is Dr. Tyrell Summers. And as an athletic trainer, I'm involved in the full continuum of care with physically active populations, from the preseason physical through early season and injury prevention strategies that we implement at the school, as well as being available on site for care and treatment of injuries of various kinds, musculoskeletal, concussions as well. And then where athletic training and physical therapy kind of merge is in the rehabilitation aspect. At the school, I do some rehabilitation work with the athletes, but it's mostly in a limited role. And that's where things kind of slide more into the physical therapy realm. As a physical therapist assistant, I work under the supervision of the primary physical therapist. And the physical therapist evaluates the patients, does intake, and develops the plan of care, and that's what I'll follow through course of treatment as a PTA within the clinic. As an athletic trainer, I work more outside the traditional hospital, on site at the school, on the sideline, or in other venues, wherever it might take us. So those are the main differences.
Okay, well, sounds like you get the best of both roles.
A little bit.
Okay, so what are the symptoms of a traumatic brain injury?
A traumatic brain injury, the primary symptoms that we see and are described are often headache, nausea, vomiting, sometimes lightheadedness, symptoms that are described as mentally foggy, unable to focus, confusion. A lot of times, a person who may have sustained a concussion will, they'll look dazed, they'll look unfocused, they may be, kind of, I want to say, making poor choices that they wouldn't normally do. They may not recognize person, places, or things that are common to them. Additionally, they may have one or two forms of amnesia. They may not remember things that occurred before the event, or they may not remember things that occurred after the event. And those are all kind of a general spectrum of things you might see. Potentially some emotional or inappropriate responses, inappropriate emotional response to various things. Also, how a person responds to various stimulus is also common with concussion, whether they become more sensitive to bright lights, loud noises as well. Those kind of external stimuli, the brain is just really has a hard time coping, adjusting with those extraneous elements after a concussion.
And how long can these symptoms persist?
That will vary from person to person or athlete to athlete. I just read a recent article published by a medical association, and for adults, concussion symptoms on average will last about 2 weeks. For younger people, adolescents, teenagers in the 13 to 18-year-old range, on average about 4 weeks, sometimes less, sometimes more. But it's very common in about 25% of concussion cases for symptoms to last up to 30 days. So there's a spectrum depending on the nature and type of injury and how the brain is affected through the concussion. It'll vary, but on average 2 to 4 weeks.
Are there different types of concussions?
There's not really different types. Previously, we used to use concussion grading scales. We would previously grade based on what symptoms felt the different grade. But we've really shied away from those over the last 10 to 15 years in favor of just giving more of an individualized treatment approach to the person, to the athlete. And then we'll just take an inventory of the athlete at the time, or the person in a motor vehicle accident. Just take an inventory and record and collect what their signs and symptoms are at the time of the event, and then from there just kind of track the person as we go. But yes, concussions will vary from very minor concussions where the person may only report, or we may only see a handful of symptoms, 3, 4, or 5, to other concussions which are more severe. They will report my symptom checklist that we use, records 22 symptoms. That can vary in severity.
Now, there's a lot of controversy out there right now as far as concussions in sports. What is your opinion as far as an age of when kids are old enough or developed enough to be able to play contact sports? Contact sports.
A lot of the leading recommendations that are coming out right now is in what we call post-adolescent. The 14 to 16-year-old age range seems to be pretty common, depending on the experts that you talk to. Just last week, physicians that are affiliated with junior level hockey just put out a recommendation that hockey should avoid the body checking, the slamming of other players into the boards, and reduce a lot of the contact until they reach the age of 14. There have been some, head injury experts. Dr. Cantu up in Boston, Massachusetts, who's one of the leading researchers. He's advocated for reducing or limiting contact football until the age of 16. So that seems to be kind of the general area. Now, can contact, or we actually call them collision sports more accurately now, can be played safely and effectively in slightly younger age groups. But the key with that is, of course, good technique in the sport that they're working in and playing in, and making sure that they play within the established guidelines of safe play. That's the main thing, is that for the athlete in the younger ages, you'll learn good fundamentals and techniques of the sport that they're playing, so that when they're in situations where they're exposed to higher energy, higher velocities, larger magnitude contact, that they're in good position and have good technique to be able to absorb and go through those situations.
Excellent. Very good information. We have a caller waiting to ask a question, so we're going to go to the phone lines. This is Aaron on the line from Mankato. Hi, Aaron. Go ahead with your question for our therapist tonight.
Hi. I have a high school daughter who is in cheerleading and does some pretty intense stunting. It makes me a nervous wreck. Should I be concerned about the risks of concussion? I know a couple of the girls have been dropped in the past.
It's interesting to me that you bring up cheerleading. One of my other areas of interest is actually cheerleading safety. I actually leave on Thursday to go to Orlando, Florida, to be part of the medical team covering high school national cheerleading competition.
Wow.
Again, the key with any sport is safety of technique and instruction. I know in general, when cheerleaders get hurt, they tend to get hurt in a higher magnitude. Because when the flyer is up in the air, their head can be anywhere from 8 to 12 feet up in the air, and so yes, there is a farther drop. There's also risk to the bases down below who are catching the cheerleader. Incidentally, I cheered at Fort Hays for a few years, so I've been on the receiving end of some of those. But the main thing in USA Cheer, which is kind of a overriding cheerleading advocacy program, has a lot of good information out about how to prevent such things in cheer. But just like any other sport, cheerleading is a sport. It is a strenuous physical activity. These young ladies and some guys that we see in cases are participating in a physical activity that requires strength, stamina, endurance, and technique. The main thing is that when your daughter is cheering, look, is this something that they have practiced before? Are the flyers and the base confident and competent in what they're doing? That's the key that I always stress, when I'm working with a cheerleading group or if a cheer coach has a question for me, is just to make sure that the things that they're doing, and especially when they're going out on halftime to perform a stunt or a pyramid, on the gym floor, is just make sure that what they're doing is something that they've done before, they're competent in, they're confident with doing it, and that they're practicing good cheer safety techniques. And there's a lot of good resources out there that are available for that. A lot of cheerleading teams throughout the state participate in what are called cheer conferences that are offered by the Kansas State High School Activities Association. And they're hosted by the state association with expert instructors that come in and teach the high school and even junior high cheerleaders, good sound technique to perform, the proper progression of stunting and pyramid building activities. So, but just like any other sport or activity, they need to be performing at a level appropriate for them. If you get out and you see that, the arms are shaking and the bases are wiggling, maybe that's not an appropriate level that they should be doing at. Instead of the overhead lift, maybe they should just be doing, at the shoulder height. But in large, cheerleading is a safe activity. A lot of states who have quote-unquote grounded cheerleading, particularly Nebraska, for several years, Nebraska State Activities Association didn't allow the cheerleaders to go up above or build any type of pyramid or partner stunt. Now that various cheerleading organizations have developed good standards of practice and good reliable techniques and progressions, Nebraska's reversed that a little bit, and they're allowing cheerleaders to participate in stunting activities at the high school and junior high level again. So again, like anything, good sound technique is the best way to prevent an injury from occurring during cheer.
Thank you so much.
You're welcome, ma'am.
Hopefully put mom's mind at ease a little bit.
So.
Let's talk about, is a concussion, do you have to actually lose consciousness to be considered a concussion?
No, not at all. A loss of consciousness is often just described as one symptom when we look at a concussion. Now, loss of consciousness is kind of that special symptom. If a athlete or a person has an impact significant enough to lose consciousness, that's what we consider a red flag symptom. That's something that warrants, referral to a physician same day or directly after the event. But it's not necessary for a person to lose consciousness to have a concussion. As I said, my checklist has 22 possible symptoms, and loss of consciousness actually isn't even on that checklist. That's just one symptom that indicates that the person absorbed a high energy event that caused a disruption in neurologic function resulting in the loss of consciousness. There's a lot of other neurologic events going on in the brain at that time and will manifest in different symptoms. But while it is a red flag, and we're going to process that through the medical decision-making tree quickly, it's not exclusive or a requirement for a person to be diagnosed with a concussion.
Okay, now if a person, an athlete, has a concussion, what is the protocol for treatment?
It'll vary from location to location. Typically, when I'm on scene or on the sideline or the game, I'll I have a protocol of checklists and evaluation instruments that I'll go through. In a typical scenario, if there's a question when an athlete comes off of the practice field or playing field, we do a very simplified assessment. I'll look for obvious signs and symptoms, and that's the advantage of being an athletic trainer who's around these athletes on a regular basis, is I can develop a pretty good idea of what their normal personality type is, if they're normally a quiet person, if they're normally kind of a more outgoing, louder person. But we'll do a basic screening to check some memory recall, some basic neurologic function. In general, whenever we have a suspected head injury, we have to rule out a neck pathology as well. And so I'll do those things, and I'll give them a simple memory recall activity, and then allow a few times and see how that person is responding. If there's enough indications or signs and symptoms that, yes, I'm pretty confident this person has a concussion, then I go to my next layer assessment, which is my graded symptom checklist. We will do some balance assessment. We will do our eye tracking or eye movement assessments as well, and just to get a good assessment of how that person is at the time of injury. Or in the clinic, if it's just somebody pretty typical in the Russell community, somebody had a fall, bumped their head, they've been having symptoms over a period of time, they decide to go ahead and go to the doctor. They'll do a lot of the similar things in the clinical setting as well. Inventory checklist, check some memory, as well as the balance and eye tracking. But it's best to get those initially. And then we typically want to follow that person over a period of time, gradually taking an inventory of how their symptoms progress, whether the symptoms become worse, what area. We actually break down symptoms into about 4 or 5 different areas that determine kind of what areas of the brain are affected, or what senses are affected, and we can modify treatment and adjustment a little bit to where those symptoms are most affected. And then we typically track the person until their symptoms are recovered. Now for the average person, okay, they feel great, they're back to work, they don't have headaches anymore, they're safe to drive. For the average person, that's kind of where that protocol ends. For the athlete, we have a few more hurdles to go through. Because we want to make sure that, especially an athlete in a contact or collision sport, we want to make sure that they're fully recovered, and we also have to put them through a return to play protocol. And this has been something described in the literature many times, many associations. And the first step is simple, increasing the heart rate. We put them on either a treadmill for an easy walk, on a bicycle, just doing an easy ride on a stationary bicycle. And we just want to elevate their heart rate. There's times when a person who sustained a concussion, they report they don't have any more symptoms, they're feeling pretty good. But after we elevate the heart rate, we get the blood pressure up in the brain, things may not all be the same. And so we want to make sure that that's okay. And then we actually wait after we do that assessment and we put them on the bicycle for a while. We actually want to wait about 24 hours because sometimes with concussion, symptoms can come and go kind of gradually. And so we want to make sure that there's no return of symptoms after that first step. The next step is increasing activity, typically more aerobic type exercise. I'll take an athlete out and do some sprint work, maybe a little bit up, running up and down the stairs. Again, we tested them at a low level of physical activity. Now we're going to increase the intensity and again allow for time to pass, see if any symptoms return. And these are all kind of stationary, controlled situations where the athlete is in full control of what they're doing. There's nobody else around. They're not worried about things. Then we add movement to this. We're going to do some position or sport-related drills where they're having to move in space, make changes of direction, vertically and laterally. This is where I'll add elements with a ball. Where they have to track not only where they are in space, but other objects or other people. And as long as they can do those things fine, then we put them into more sport-specific drill situations that are controlled. Whether it's one-on-one, small group, but in a situation where if they start feeling symptomatic and they need to take a break, they can tell their partner that they're working against, for example, in wrestling, hold on, buddy, I don't feel real good, and so it's a controlled situation. And once they pass those steps, we go back to full live practice, where they're tracking multiple people, multiple objects, remembering where they're supposed to be on the field and play. But at the end of all that, we do all this testing, we still go back to the doctor and say, everything's good, is he good to go? Mm-hmm. And sometimes the physician feels confident in the athlete's recovery, sometimes they're not, and they want to wait a little while. And that's okay, especially when we're working with the adolescent, because we want to do everything and make sure we've done our due diligence to avoid any subsequent injury after that.
Okay, we're going to go back to the phone lines now. We've got a caller on the line from Great Bend. Go ahead with your question for our athletic trainer tonight.
A few years ago, my grandpa got pinned by a cow and had a brain injury. He was supposed to have a follow-up appointment and never did. How important is it that he should do that?
That's always very important to follow up with your family practitioner, especially dealing with livestock. That's one thing I've seen in the rehabilitation department. Working livestock is one of the top 3 most dangerous occupations in the state of Kansas. But yes, it is important to follow up with the family provider. While initially, he may have had concussion symptoms and may have resolved, it's still very important to go back, especially if it's a family physician that he has a long-standing relationship with. Because especially in older populations, concussions are not very forgiving for older individuals, especially in the 65 and older range. So that is very important because there may also be other issues that can develop, especially with, again, dealing with older folks. They're higher risk of blood clots, they're higher risk of aneurysm. There's just a lot of other potential pathologies that can come up that a primary care physician is going to want to track and keep updated. They're going to potentially, look at if your grandfather's on sort of blood thinning medications. They may want to take that in consideration and maybe make some adjustments with that. So and if he has any other health issues, whether it be cardiac or diabetes, those are things that they need to be aware of including the concussion or the brain injury. So there's a lot with older individuals, there's a lot of things in play. And so that primary care doctor is going to be a good resource because the primary care physician keeps everything within context. Yes, we do refer out to neurologists and neurosurgeons, but that primary care physician is going to be the person who takes all that information and works with the patient to make sure they get the best care possible.
Okay, we just have about a minute left of the show, but real quickly, you might tell us if somebody has suffered a concussion but has not been to the doctor, what are some red flags that they might experience that, yes, you need to get to see your doctor?
Okay. Key red flags that we look for are nausea and vomiting that doesn't resolve. I tell parents to just kind of take normal stock, assess your son or daughter as they are now, but so nausea, vomiting, poor cognitive decisions. If they start not making sense with their words, start using inappropriate words, if the headache becomes more severe, especially over time, loss of consciousness, or fading or transient consciousness, where they're kind of lucid for a moment, then they're not making sense. Those kind of things. Pupils dilating, increase pressure in the head. Those are pretty typical red flags that we look for. And if that's the case, if you start seeing these things or their condition just starts to change for the worse, or things just don't feel right, go see your physician, go to the emergency department. You can't go wrong doing that.
Okay, great. Great information tonight. Thank you so much for being our guest. On our next Doctors on Call, we'll be discussing pet health with veterinarians Steve Mosher and Matt Nichols. You can also email questions for our next program. That address is doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Doctors on Call is made possible in part by an underwriting grant from Grove County Medical Center in Quitter. Healing through caring.
Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A Value Kansans Trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Coastal Regional Hospital, experts, neighbors, friends.